Hi, my name's Phil. I like talking about politics, and in this video I'd like to discuss the news that data on infection rates and fatalities in care homes has been deliberately kept secret in order to prevent criticism of privatisation in the care of the elderly in the UK. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So, to begin with, the government completely suppressed the numbers of people infected with and dying from COVID in care homes. Then we did get the overall numbers, and then they went through various fiddling filters. But nothing could hide the fact that they were absolutely horrific, as expected. But you won't know how those numbers were distributed. You won't know what the figures are, for example, for the care homes where you may have friends or relatives, or where you may be thinking of going in your or the advancing years of your friends or relatives. And this is because the Care Quality Commission in England and the Care Inspectorate in Scotland are withholding these data, because to release it would undermine the system, which is heavily reliant upon privatisation. A Freedom of Information request was submitted by The Guardian, for which they've written an article, which forced a few responses from these organisations. Now, one was that there is a fear that if people left the providers that performed worst, as you imagine people would, then there couldn't possibly be the supply in either country to meet the demand. In fact, the English version said that the release of the information would prejudice the commercial interests of care providers. So the cited reason for not providing this information is based on wishing to protect the profitability of care home providers, who, particularly those who have a static high approach to care, because the vast majority of care home providers are private. So, people aren't going to pull people from one care home and put them into another. It's all privatised, unless, of course, some care providers seem to have much worse figures than others, and this indeed is the case. And this isn't for once, it's actually not for once, but generally speaking, when we talk about anything like this is Boris Johnson and his let's just get through today type of attitude with anything to do with government. But actually this is exactly the same problem north of the border as well, because the Scottish version also said that because there are potential reasons for keeping information from the public at times in order to avoid undue panic. But again, the Scottish version cited as the reason, they said that transparency would prejudice services commercially. So again, the concerns for profit on both sides of the border here. And don't get me wrong, the reason the death toll was so high in care homes has as much to do with the fact that fundamentally the respective governments didn't shield effectively, didn't act quickly enough or strongly enough to shield those care homes. But there is widespread disparity amongst care homes. So, because if it was just down to those governments, you'd see a relatively even distribution. But what's known is, without knowing the detailed figures often, that care homes with larger and what might be termed in business sense more efficient homes showing the greatest infection rates. That means that the way care is provided is key. A profit-first approach has also clearly contributed to this appalling human calamity. And like I said, this is not specifically a Boris Johnson and Matt Hancock issue. The Scottish government are also keeping this information secret, and for the same reasons. And this tells you something as well about the concerns for profit, about the genuine fears that there are for even a relatively sane government. I mean, the Scottish government hasn't got everything right. And also sometimes where they have made mistakes, they've sought to cover up those mistakes. It isn't ideal. But they are a relatively sane government. I mean, we all wish we had someone like the Scottish government in charge of the whole UK. We would have done a lot better. And you imagine the situation, you think to yourself, well, to be fair, when you sort of think, you can blame what's happened in the past as much as you like, but you are where you are, and there can't possibly be a quick solution. The Care Quality Commission, which is the English version, did also state that were the information to be made public, it would drive people's behaviour in pulling relatives from certain care homes and seeking to deposit them into ones perceived as safer. mistakenly perceived in their view. And you imagine yourself in government. You get to decide these things, and you're in this mess now. Never mind, you could say to yourself, well, if I'd been in government for 10 years, we wouldn't be in this mess. Fair enough, but you are. Let's say you've just been installed into government. And you could certainly appreciate the panic that this would cause, and the fact that, it would put an impossible strain on the system. It's not like there's lots of slack in the system. And, well, sod those care homes that don't run enough staff or have too many residents in the same place. Let them fail. We'll just put them somewhere else. If there's nowhere else to put them, it's already a service that's not exactly got spare capacity. So in one sense, I can understand the motivation to keep the information from the public, though I do not agree with it. I think on balance, it needs to be made public, because then the public need to demand that government do something. But what any decent government must surely do is recognise that the current system of care provision is harmful and particularly dangerous at such a time. Remember that although people, from the start keep drawing comparisons between the COVID pandemic and Spanish flu like a century ago, and that leads you into the iffy thinking of, oh, it's a once in a century event, because the problem with that thinking is you go there, well, we are where we are. We can't put everything right in the next couple of years anyway. In a couple of years, COVID should be dealt with. It's an aberration. Yeah, all right, government should probably do something slowly over time so that in another century, when we have another one of these, we're in better position. But you know what? That's other people. No. This was a forewarned event. And modern globalism makes pandemics like this more likely. They'll happen more frequently. We could easily have a new pandemic sweeping the world within the next decade. There's nothing to stop it happening, even before COVID has ended, although I suppose COVID-related travel restrictions would make it less likely. But it could happen. So it would be a dangerously reckless government that does not seek to identify all the weaknesses in every system that failed, which is most of them, and seek to urgently address them. Because, my issue with a government that tries to suppress information is you can make the argument you're trying to do it to avoid undue panic. But a government that admits to certain things, who makes information available, is also basically saying, I'm going to do something about this. Now, a government suppressing information may also privately seek to do something about it, but how are you going to make the case? Because to do something about it needs legislation, needs different forms of government spending. It means you're going to have to explain yourself publicly anyway. Well, how are you going to do that if you're suppressing the information on which those decisions are based? I'd be much more comfortable with governments, both north and south, but in my particular case, mostly south of the border there, making the information known so that then there's an imperative to do something about it, and do something about it quickly as a priority. Because, we don't just need to put things in place for future COVID peaks, which for some things, as I say, it may take a few years. We may not be able to do it for that. But future pandemics, which may not have very many years before they hit again. And this news of secret care home data also follows on from more publicly available research, which highlighted that large care homes were much more likely to see coronavirus outbreaks, and that low staff to resident ratios also increase the risk. I mean, those things seem obvious enough, but it is important to test out those hypotheses with proper research. Some care homes have actually volunteered the information themselves, but getting data directly from a private company is less ideal for two reasons. Firstly, they'll have their own system for collating and presenting the data, usually to paint themselves in the best possible light. So it's not always a like-for-like comparison between different providers. There may be varying levels of fiddling the figures. Secondly, not all providers are revealing their figures, so you don't get a complete picture. Now, were the data provided by a public department, it would be consistent and also should be presented in what will be believed at the time to be the most useful way. Being reliant upon privatisation of a vital public service has been utterly exposed by this pandemic. And by way of highlighting just how damaging this really is, the Conservative government, I'm going to have to stick up for them here, they have very thoughtfully used private companies with no experience of healthcare to deliver our failing PPE procurement schemes, our failed test and trace programs, our failed awarding of exam grades, and soon they're going to be using private companies to coordinate healthcare in England, replacing the publicly funded Public Health England. And of course, that will also fail. It's actually really rather nice of them, and they're not getting enough credit for this. It's very nice of them to highlight just how damaging to a country and its people rampant, unregulated capitalism really is. And just again, so that I can emphasise just how great this undervalued Tory government is, they also helpfully showed us the flip side. Because it's all right saying, well, look, we're proving to you that unregulated capitalism is a load of rubbish, but that's not any good if we don't show you the alternative. So the only government approach that has actually worked this year, that has won plaudits, that has functioned, is the job protection scheme, the furlough scheme, that adopts socialist policies proposed by left-wing parties in the UK and elsewhere. I mean, bravo, Boris Johnson, take a bow, because he's given us a practical demonstration about how, particularly when times are tough, only socialism actually works, and unregulated capitalism just makes things much, much worse. So what I would say to him is, thanks, Boris, but I think most people have got the message now, so I'm going to guess that this social experiment can end and that we can all stop this tomfoolery with billions upon billions of pounds being given to private companies. Let the private companies fight for their own market share with only the good businesses thriving, and let public money be used for state-owned operations. There's a good chat. But anyway, those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.